Hi, I'm Caitlin Kavanaugh. I'm a Senior Associate at SurgWise Consulting and the Leadership Institute Analyst for MD Anderson. Thanks for having me to talk about some research around differences in surgical training program preferences among women and minorities and how that can be used by training programs seeking to increase the diversity of their trainees. I've already mentioned I'm a member of SurgWise, which provides advice and guidance on selection and assessments to surgery residency programs and other organizations. Diversity is important. That should go without saying. We know that more diverse healthcare providers lead to a variety of better healthcare outcomes. Currently though, surgery residents are mostly male and mostly white, even though similar rates of men and women apply to surgery. So how do programs seeking to increase diversity do that? Some programs have tried scholarships or second look events for underrepresented minority candidates or URM candidates, but what actually works to increase diversity? We don't know. When you search increased diversity of surgical residents in PubMed, only 11 items appear. So we turn to the psychology research literature on applicant preferences. This is grounded in social and group identity theories, which say that your sense of who you are as a person, based on your group membership like gender and race, can be used to predict some behaviors and preferences. Organizational psychology researchers have found that women value working conditions and interpersonal relationships when they're thinking about working for a potential organization. Ethnic minorities prefer organizations with collectivist cooperative orientations. We wanted to see if similar patterns exist among surgery residency applicants. So we surveyed 1,500 applicants applying to one of 7 surgery residency programs that implemented evidence-based methods to match their candidates based on fit. They each completed a 31-item training preferences assessment, measuring their preferences for training environment and program attributes. We conducted an exploratory factor analysis to identify the themes amongst the 31 items, and we found 8. They were social support, academics, turbulence, innovation, traditionalism, clinical experiences, flexibility, and social cohesion. Our ANOVA results suggest that women prefer programs that are higher in social support and lower in turbulence and traditionalism. Non-white candidates preferred programs higher in social support, academics, innovation, clinical experiences, flexibility, and lower in traditionalism. Differences in training program preferences do exist across genders and ethnicity, and this information can be used to inform strategic recruitment strategies for programs seeking to increase the diversity of their trainees. Here are some practical tips to do so. Consider the diversity cues on your website and recruitment ads. Make sure they reflect the diversity of your trainees and that every piece of communication has an equal opportunity employment statement on it. Consider targeted recruitment advertising. This means promoting your program at historically underrepresented schools like Howard in DC or Morehouse in Atlanta, or promoting your program at schools like UC Davis who graduate large percentages of women. Promote policies of inclusiveness, starting with the recruitment process. Tell your candidates about the demographic breakdowns in your program and if you expect that to change in the future. Talk about your current and future programs that reflect your values on diversity. Make sure your URM faculty are featured on your website and are a part of your recruitment process. Psychology research shows that when you see yourself or someone like you at an organization, you're more likely to perceive that you'll fit in there. Most importantly, be sincere. Make sure everything you're telling your recruits is an accurate representation of your program. If you share inaccurate information, this could lead to unmet expectations, which could result in turnover. Finally, please don't set quotas. Quotas are illegal. Thanks for having me to talk about this research. Thank you to my colleagues and partners in this endeavor.